Hello, this is a virtual pathology specimen of a case of embryonal carcinoma of the testis. We have here the testis, which is enlarged, and the spermatic cord. Let's just move this around and you can see the coverings of the testis are intact. Within the testicular parenchyma, there is a large, fleshy, pale tan tumor, and we can see the tumor in this region. It is replacing pretty much the entire area of the testicular parenchyma in this cut section, and the tumor is also involving part of the spermatic cord. If we look carefully at the cut surface of the tumor, we can see that there are some paler areas here, which likely represent areas of necrosis, and this is commonly seen in embryonal carcinoma. We also see some darker, almost blackish areas, and these are areas of hemorrhage. Let's learn a bit more about embryonal carcinoma of the testis. Embryonal carcinoma is a malignant germ cell tumor of the testis. It is uncommonly pure and it usually occurs together with other germ cell tumors, for example, embryonal carcinoma mixed with seminoma or yolk sac tumor, teratoma, or choriocarcinoma. Clinically, this will present as a unilateral, painless testicular mass, although sometimes there can be a dull, aching sensation or discomfort in the scrotal region as well as the lower abdomen or pelvis. This tumor may also present initially as metastatic tumor. For example, if there are lung metastases, there can be hemoptysis, or if there are bone mets, the patient may complain of back pain. When it does metastasize, it tends to metastasize to the retroperitoneal lymph nodes. So in the initial diagnostic and staging phase, imaging of the chest as well as the abdomen is very important. These tumors may be associated with raised serum tumor markers, although not always. For example, alpha-fetoprotein or beta-HCG. Grossly, the tumor usually appears as a gray tan mass, and it can appear quite variegated with areas of paler necrosis, as we saw earlier, as well as darker areas of hemorrhage. Here is an example of a very fleshy tan tumor. If there is a mixed germ cell tumor, meaning embryonal carcinoma admixed with other germ cell tumors, then the cut surface may look a little bit more heterogeneous. For example, if there is a seminomatous component, that usually looks more solid, and the embryonal carcinoma areas will appear more necrotic, friable, and hemorrhagic. These labeled pictures, together with the virtual pathology specimen that we saw earlier, are available in Pathweb, our free online pathology resource. You may register for free and the link is in the video description. Here is an example of a mixed seminoma and embryonal carcinoma, and the seminomatous areas are usually more homogeneous, pale tan looking, and this is the area of the embryonal carcinoma. We can also see here these pale areas of necrosis, and within the embryonal carcinoma component, we can see some areas of hemorrhage. Here is another example of an embryonal carcinoma where you can see this fleshy, pale tan tumor with darker areas of hemorrhage, and this is the normal, uninvolved testicular parenchyma. There is a separate video demonstrating a virtual microscopy slide of embryonal carcinoma admixed with seminoma. Briefly, on microscopy, we will usually see several growth patterns. There may be some more solid or sheet-like areas admixed with glandular areas, like here we can see some gland formation, and also sometimes papillary areas. And in this tumor, we can also see that there are many areas here, and here of necrosis. The cells are usually large and pleomorphic. They are polygonal in shape, and mitotic figures are frequently identified. Here we can see two mitotic figures, and many of the cells have large nuclei with prominent nucleoli. We also frequently see necrosis, and here is an area of necrosis. There may also be other admixed germ cell tumor components, for example, seminoma, yolk sac tumor, or teratoma. Hence, in summary, this is an example of an embryonal carcinoma of the testis where we can see a large variegated appearing pale tan mass with paler areas of necrosis and darker areas of hemorrhage, and this particular tumor has grown into the spermatic cord. This virtual pathology specimen is also labeled, and you can see the annotations, and this is found in Pathweb, our free virtual online pathology resource. If we scroll down, you can also see additional information and examples of gross and microscopic images. Thank you.